Plus, the plastic surgery trends at the royal wedding. That's today. Then, plastic surgery trends on the horizon.
Good plastic surgery is never obvious.
2017 was the year of the rear, but what are the new hot plastic surgery trends right now? Board-certified plastic surgeon Dr. Ashkan Ghavami joins Dr. Orden to give us all the inside scoop.
When we're doing facial rejuvenation now, facelifts, most cases we're moving the
shape.
It's shaping and adding volume where you need it, because we know part of aging is losing volume.
I always tell my patients, the plastic surgery and beauty is never about size. You can be a size 14 woman and look damn good in it, you know? Or you can be a size 6 and not look good because you're kind of square and you want proportions, you want more hips. In the face, too, it's all about facial contours. When we look at beauty, we look at convexity, we look at highlights and shadows, the way the light hits the body or the face. But fat transfer is no joke. We're seeing problems with it when people aren't injecting it properly, especially in the buttock. There are disasters that can happen because if you inject it in the wrong place, it can go into veins and things. So you have to go to an expert. You have to go to a board-certified plastic surgeon. No plastic surgery is any joke. It's not going to a med spa. You have to do it expertly and do it well. But the technology is amazing, and we're still learning about fat. It has so many benefits.
With the new Duchess, right, Meghan Markle has stimulated, rekindled an interest in rhinoplasty, right? Before it was Angelina Jolie, everybody came in with that picture wanting that nose. Now they're...
Well, Meghan Markle, the good thing about her is, what I love about her is a lot of plastic surgery. I mean, rhinoplasty started in 500 BC in India. So the roots of rhinoplasty are ethnic, they're non-Caucasian. So Meghan Markle is absolutely stunning, and she has best of both worlds. And if you look at her nose, it's not, there's a little hump, but who cares? The tip's a little wide, but who cares? She has beautiful features. Her tip has that sculpted shape, and it really works for her. It's beautiful. It has a good shape. It goes with her. And it's what I call, racially congruent. It doesn't look awkward on her, and it has the proportions that match her face. It's not too small, not too big, and with rhinoplasty, it's in the center of the beauty triangle. So if it is a little bit off, it can throw off everything else. But
you do, I'm assuming, have to tell patients who come in and say, hey, I want Angelina Jolie's nose or Meghan Markle's nose. That may not be the right nose for them.
Exactly. These days, people bring in Facetune Photoshop photos of themselves on their Instagram.
Oh, yeah, they do.
They're experts now. Like, I have 17-year-old girls that come in for rhinoplasty, and I'm like, how did you do that? It looks gorgeous on their Instagram feed.
Well, the good news is at least people are hopefully doing their research, and I know that you two do a lot of rhinoplasty. One of your patients in particular, Sarah, she went to see Dr. Ghavami, and after seeing him, and I guess you've worked with the Iggy type noses, right?
Yeah.
Well, Sarah was ready to turn her so-called booty nose to an Iggy nose.
I'm here because I want my nose done. I think it looks like a butt from up here. It's been an insecurity of mine. I just feel like as the older I got, the bigger it got. I worked with Dr. Ghavami, and I used to always love when he used to do his nose job. I was like, oh my God, I'm next. So after he did Iggy Azalea's nose, I was like, oh, that's it. Tap, tap, break the bone, bye.
Hi, Sarah. How are you? One of the things we joked about is how you have what you call like a butt nose. And this is one of the main things I also did for Iggy, where she had her tip cartilage was very wide. So we're gonna take these two cartilages here that bubble out, reorient them here and flatten them out so they're not as bubbly. This is gonna look like you just happened to be born with that kind of tip. All right, we'll see you in the room. Let's get this started, okay? We just made the first incision, and we're gonna go ahead and expose the nose. I'm gonna go in between these two cartilages from the top all the way down to the septum, because I wanna get all the bone and cartilage way in the back that's interfering with her breathing. We're gonna go ahead and just file down a little bit of the top of the bone here. Okay, so we got this septum out right now. Now I'm gonna shape this into puzzle pieces and support and shape her tip with it. There it goes, nice and beautiful. Now that's a gorgeous tip. She's gonna love that. Everything's gelling nicely and smooth. Wow. A lot of work.
Sarah is here. She is healed from her surgery. How do you feel?
I feel great. I love how natural it looks. And Dr. Ghavami just did an amazing job. And thank you, thank you, thank you.
Well, that's the key. Very natural. Does not look And that's another thing that I say is the days of old-fashioned cookbook nose jobs are gone. Tell us exactly what you did there to achieve
Of course.
that.
I mean, you know, as you know, Drew, it's not just about if you have a big hump, go get a nose job. Sometimes people want some sculpting and certain things done. You don't have to have this huge nose to want it. So she actually had a cute nose. I mean, no one needs plastic surgery. But her nose had this like buttock type shape to it. It had a little cleavage, it was wide and a little flat in some areas. And it kind of, when she took photos, it kind of took center stage. So I took a little bit of the hump down, kept it relatively straight as she requested, sculpted her tip. The reason you saw it look so graphic is if you want to do a rhinoplasty, in my opinion, properly, you have to sort of lift the hood of the engine.
So-called open rhinoplasty.
Exactly, open rhinoplasty, because it's like a Lamborghini. You're not going to be able to work on that engine through a little hole with a light. You got to lift the hood and work on it. It's complicated. And, you know, she got inspired by Iggy, and Iggy is so awesome. And to be open about it, as most celebrities aren't, you know, to be a part of not the secret glam squad, but to actually be known as being one of the key integral parts of a glam squad is really honorable when celebrities are open about things for me and him, because otherwise, the only way we see our afters is looking at the red carpet. Oh, she looks good. I haven't seen her in a few years.
But you can't say that.
Exactly, yeah. So.
Well, I love that you're working with each individual patient, working with them, what's best for them. Sarah, we're so happy that you're happy.
Thank you. I'm so happy.
And I would just reiterate, for the sake of everyone watching, as you mentioned earlier, if you're going to get something like this done, go to a board-certified, reputable plastic surgeon who is an expert in whatever particular surgery you're looking to get done, and then you can get a result like Sarah's. Gentlemen, Dr. Ghavami, thank you so much.
Thank you.
Sit down.